Hey, Rebecca.
Hi, Amrit. How are
Hey.
you?
Good. And you?
I'm fine, thank you.
Great.
Just trying to understand Teams here.
Um, Not so complicated. Hi, Jayashri.
Hi, Amrit.
Hi.
Hi, Rebecca.
Hi.
Hi.
Hi, this is Deepak.
Hi,
Good
Deepak.
evening.
And I can hear some birds in the background from some of you. Sounds so nice.
Hi, Deepak. How are you?
All well, thank you.
Great.
Hi, Dr. Deepak. Can you hear us?
Yeah, I can hear.
Perfect. Okay.
Hi everyone, I hope that you can hear me. I think that we have decided that we will wait 1-2 minutes, as we can see that a lot of people are joining at the moment. And then we will start with the introduction. I will go to the agenda and also the speakers. Thank you.
Good evening, Dr. Kuldeep. Welcome.
Doctor. Good evening. How's the thing going on there?
We're having everybody on the Teams meeting today.
Okay.
Yes. We're just waiting 1 or 2 minutes to start.
Okay, I think that we can start now, and then other people will join as we are opening this session. And firstly, of course, I would like to welcome everyone that has joined to this webinar on the India-Sweden Healthcare Innovation Challenge, as well as Innovation Center. I think many of you already know me. I'm Sofia, working for Business Sweden and also a part of SI's alumni office here in India. And of course, we are very happy to have everyone here from the Alumni Network, which is a very interesting network here in India. A lot of activities ongoing. And we are also very happy to have this webinar together with the SI and also the embassy as a part of Team Sweden, where we also today have, of course, AstraZeneca and AIMS Jodhpur as well. I know that there might be people calling in that have been studying in Sweden that might not yet be a part of the alumni network in India. And I highly request you to join the network. So therefore, if you're not yet a part of the chapters, please let us know in email afterwards and we can connect you to the right person. With that said, I also, before I go through the agenda, I would require everyone to please keep the video off if you're not a speaker, as well as to keep yourself on mute. As we are having an open Teams invite, it can get pretty blurry otherwise if people keep the mics on. I also request you during the webinar to write your questions in the question kind of panel on the side, as we will take this up in the end. We have saved some time where we will approach questions and also answer them. So we will approach them in the end, but you can write them during the webinar. Then I, of course, would like to go through the agenda and our exciting speakers. So this webinar will start with an opening remark from Rebecca Andersson. She is the alumni manager for Swedish Institute. We will thereafter follow the introduction of India-Sweden Healthcare Innovation Center, which will be made of Amrit Hinduja and also Shubhang Vikas. They are both senior managers at the Business Sweden. Followed by sharing the background of and the introduction of the Innovation Challenge. And then I'm very happy to welcome Dr. Deepak Shah, Professor and Head of Neurosurgery for AIMS Jodhpur. And there followed by Ms. Yashri Mapari. She's a market access lead for AstraZeneca, and she will go through the details of the problem statement. And in the end, of course, what I mentioned, we will have some open forum and try to answer as many questions as we can, followed by a closing remark from our side. With that, I would very much like to leave the word for Rebecca to say a few words on that side.
Okay, hi everyone, can you hear me? Yes, I assume that's a yes. My name is Rebecca Andersson. I work with alumni relations at the Swedish Institute. We just want to say from the Swedish Institute side that we welcome you all to this webinar organized by Business Sweden. It's very nice to see so many familiar names and also quite a few new ones, as Sophia mentioned, as you might not be part of the alumni networks. And we really, really encourage you, if you're not, to email Sophia or Amrit to be able to join your local chapter. As you might know, summer has officially ended in Sweden and things are starting to take off again. Many who of you have been to Sweden or been in contact with Sweden know that we have sort of a silent period during July, August, where many Swedes are on vacation. But now it's fall again and things are starting to move. So we're very happy that Business Sweden is kicking off with this seminar. And this is actually also a follow-up webinar to the alumni webinar held in June, which was the Swedish battle with COVID-19. So I just want to say welcome. We're very excited that you're all here. Thank you.
Super. Thank you so much, Rebecca, for that welcome and introduction. Looking forward to hear the questions from the network as well, as I know many of you are actually involved in healthcare activities. With that, I would like to leave the word now to Amrit and Shubhang from Business Sweden to introduce the India-Sweden Healthcare Innovation Center.
Great. Thank you, Sophia, and thank you, Rebecca, for being able to join. Good to see many familiar names, as Rebecca said, and of course, many new names, I think, from alumni who maybe we have not met before. My name is Amrit Hinduja. I'm also an alumni of the Swedish Institute and working with the Swedish Trade Commissioner's Office in India. And both me and my colleague Shubhang are happy to spend the next few minutes to walk you through and introduce you to the Innovation Center concept that we have launched. Just to set a bit of context of this, both India and Sweden have an MOU in the area of healthcare, which is a G2G agreement to cooperate within the area of health and public health, a very wide area. And as part of that collaboration, as well as keeping in mind the spirit of the Joint Innovation Pact signed by PM Modi when he visited Sweden in 2018, under these umbrellas, we have created a collaboration to work with innovation in healthcare. We call this the India-Sweden Healthcare Innovation Center, and this has been this is a tri-party collaboration between Sweden, represented by the Swedish Trade Commissioner's Office, as well as AIIMS Delhi and AIIMS Jodhpur, which are leading healthcare institutes in the country, as many of us know. The photograph you see in front of you is of the collaboration signing, which took place in December during the royal visit. And to us, in many ways, it's not just a photograph, but it shows us the commitment, both from the Indian side and Swedish side, behind this initiative that we have, with the participation at the top level by the ministers of health from India, the secretaries from both countries of health, as well as the director of AIIMS. And I think with this, we kind of got going with creating the India-Sweden Healthcare Innovation Center. The word center might be a bit misleading, we often say, because what we are trying to do really is create an ecosystem for healthcare innovation. And though we will be, or rather are at this point, geographically centered at AIIMS Delhi and Jodhpur in some senses, with some things that will take place on ground there, we are actually creating a network across the country and across both the countries, India and Sweden, to work and fuel healthcare innovation. When we talk about innovation under this collaboration, it's one usually thinks about technology, medtech, or solutions, devices, but we have chosen to kind of have a more holistic approach where we look at it in a wider perspective, and we will tell you more about this as we go along. And the overall objective and vision with which we have created this is to kind of identify challenges in the Indian healthcare system with AIIMS Delhi, AIIMS Jodhpur, our partners at both the ministries and ICMR, and lift those challenges to then find solutions with the innovation ecosystem across both the countries. And this has been built towards addressing the country's need for affordable, accessible, frugal healthcare. And therefore, when we talk about this, we're inviting a collaborative open ecosystem of innovation across startups throughout the early stage, mid stage, as well as late stage and scale up, with the idea of how to support you to kind of commercialize and go up the value chain. And of course, keeping in mind also the entire frugality in mind. With those few words, I invite Shubhang to walk us through our holistic approach in this collaboration.
Sure. Thank you so much, Amrit, and good afternoon, good morning, good evening, everyone. Very good to see a very enthusiastic participation, at least in terms of the number of participants we have. So thank you so much for taking out the time. And as rightly mentioned by Amrit, center is a bit of a misnomer. What we are creating is an innovation, open system of innovation, right? An open innovation ecosystem. And to top it off, we're also looking at something that we call holistic. Now, why holistic in that sense? Very often that we find that innovation or new ways of working gets constricted, shackled, because innovation and development of solutions and new products or new protocols often happen in silos. I think there is brilliant innovations happening across India and across the globe, but the idea that of having a platform where you not just ideate, test, and develop solutions, but also a platform where you can scale up your solutions, right, and actually create an impact. For now, at least in the Indian healthcare ecosystem, and in the future back in Sweden or across the globe. And to create that impact, it is very essential to work with many different partners across this healthcare delivery system, from government to academia to the startups themselves, and even with industry. Now, even though innovation in that sense needs to be very free-flowing, we do need to give it some direction. We do need to provide some building blocks or drivers or pillars within which our center or our ecosystem will drive innovation in to create the impact that we anticipate over the next couple of years. So the very first pillar is protocols and processes, which basically is the continuum of care or the patient life cycle, from awareness, treatment, rehabilitation, follow-up, so on and so forth. So we would enable innovation in these protocols and processes so that it becomes effective, so that the efficacies of these processes are improved for both the medical practitioners and for the patient himself or herself. Second is technology. With the advent of digital technologies over the last decade, and with the commonly heard names of AI, machine learning, IoT, the very way healthcare can be delivered has changed. The business model can be reimagined. But we also understand that, or we also want to push through, is that we will not just enable innovation for technology's sake. Technology has to be a driver, an enabler for improving healthcare delivery in the country. Technology will play a very important part, but it will not just be the end goal of this particular innovation ecosystem. Third is business model. How can we innovate to ensure that the cost burden of healthcare on both the healthcare system, which includes the government and government agencies, private hospitals, and the patient themselves, is reduced. Fourth is data. As a country, we produce copious amounts of data, but I don't think we are doing a great job of using the data very effectively. So how can we use data? We can process data and disseminate data in a very effective manner, so that we are able to affect the changes in the business model, so that we can make the use of technology much more effective, and so that we can improve the protocols and processes in itself. And also, how can we generate data from this innovation ecosystem so that any and every innovation that comes out of it is evidence-based, is fact-based, and hence the credibility of such an innovative solution will increase, and hence the scale-up of those solutions across the country will increase. And last but not the least, skilling or capacity building is extremely important for us. We can come up with the best innovative solution possible, but unless we train the folks who would actually implement the changes in the healthcare delivery system, which are your medical practitioners, nurses, paramedics, and every stakeholder in the system, we won't be able to achieve the scale that we require, and we won't be able to achieve the impact that we so desire. So these are the 5 pillars on which our holistic innovation, holistic ecosystem of innovation system is based on. Now, if we move on to the partners of this particular center or innovation ecosystem, most of you are associated with Sweden in one way or the other. So you're very much aware of the quadruple helix model that we follow. So we have tried to follow the same model while partnering up with stakeholders and mentors and so on and so forth. So from the government side, we have the backing, or we are proud to call Ministry of Health, Government of India, and Ministry of Health, Government of Sweden as a partners. So in that sense, there's a lot of visibility and focus into what this innovation center can achieve over the next couple of years. Apart from that, we have the Embassy of Sweden in India, Invest India, CCAMP, which are subject matter experts in healthcare and life sciences and run a lot of incubators, Atal Innovation Mission, ICMR, or the Indian Council of Medical Research, which are at the forefront of defining and redefining protocols and processes that are followed across the country, and Startup India and Agni. The second category, and a very important category, is academia. And All India Institute of Medical Sciences, New Delhi, and All India Institute of Medical Sciences, Jodhpur, are our collaborators in this particular initiative, and they're extremely important. As we go through this presentation, you would realize that we are building physical infrastructure at AIIMS Jodhpur in terms of incubation center for the startups who would wish to come on board with us. And apart from just the incubation center, these particular academic institutions will open up their lab facilities, their mentors, their faculty, and a whole lot of other facilities that is required for a startup who is either at the ideation stage or at a scale-up stage. Third, knowledge and technology partners in terms of AstraZeneca, which has done a lot of work in innovation across the country and across the globe. And they bring that subject matter expertise from the industry, which will be extremely important for the startups who get onboarded. And NASCOM, who are our technology partners. And last but not the least, we are doing everything in this particular center to kind of create a mechanism for these startups to succeed. We are creating a platform where startups can be onboarded, can succeed, and so that they can scale up. And they are the focus of this particular innovation center as well, and so are one of the most important stakeholders. With that, I will pass it back to Sophia, and we'll be happy to take questions at the end of the session. Thank you.
Super. Thank you so much, Amrit and Shubhang, for introducing the ecosystem and Healthcare Innovation Center. Of course, now we want to hear more about the background and introduction of the Innovation Challenge. And therefore, I would like to welcome Dr. Deepak Shah, Professor and Head of Neurosurgery at AIIMS Jodhpur.
Can you see my screen? Hello?
Yes. I can see your screen right now.
Good evening, everyone, and thank you, organizers, for giving me this opportunity. So I'm a neurosurgeon, so I will be giving my observations and perspectives with regards to cost-effective innovations. So there are disclosures. I have filed 9 patents for various cost-effective innovations. I have presented various lectures related to the subject, and I have publications related to frugal innovations in specific. And now currently we are working with IIT Jodhpur on the topic of an endoscopic camera system, which is funded by BIRAC, and it is too related to cost-effective endoscopic camera system for endoscopic medical use of endoscopes. So our generation of surgeons or doctors are poised delicately. We have worked in the 80s, late 80s, and now after in this century also. So if we talk about neurosurgery in particular, in the early 80s or 90s, X-ray, manual surgical instruments, stainless steel implants which were used for spine surgeries, and mechanical valve shunts which were used for hydrocephalus in neurosurgery were used, and these were the baseline support systems of neurosurgeons. Now these have been replaced by MRI, PET scanner, SPECT scanner, pneumatic and electric high-speed drills, instruments, titanium and biodegradable implants, spinal implants, navigation system, programmable valve shunts for hydrocephalus. So things have so much improved that now, initially the access there was disparity in access to the healthcare, but now that gap has widened further, and now access to a large population is not there. So we do have problems related to infrastructure in India and including 172 developing countries around the world. So in India, in last 2 decades, private sector has overtaken the number of beds in comparison to the public sector. And unfortunately, the lower and middle class population, which make more than 80% of population, they mainly depend upon public hospitals due to the cost, because they can't afford treatment at corporate hospitals. So since beginning of this century, there were many researchers, scientists and reputed people have worked, government, non-government and academia came up with various articles, projects, researches that looked into this issue of cost, due to cost, healthcare inequalities due to cost. And if I talk about neurosurgery in particular in India, at this point of time, there are nearly 100 medical colleges where neurosurgery facility is being provided. Only 15 out of 100 are well equipped. More than 75 are poorly equipped. So just to give an example of a particular problem, nearly 6,000 to 7,000 spinal cord injury of cervical spine. This is the incidence, annual incidence in India, 6,000 to 7,000 cervical spine injury who need surgery. With the current infrastructure, we cannot provide surgical treatment to more than 1,500. So nearly 5,500 people get no treatment, mainly due to the cost of the implants, equipments and treatment costs. So this is true for all the diseases, almost all the diseases in India, in all the fields, and including 172 developing countries of the world. So what is the current scenario? Cost of healthcare has spiraled out of control to the extent that even developed world's economy is being threatened. There is a strange thing, there is a perception around the world that Indians are highly skilled. They have got deeply frugal mindset. And this is due to their exposure to local problems daily, and they come up with strange solutions of these problems. And this has been talked about in various literatures around the world by various people. There is another problem in the Western countries where healthcare facility is very much advanced. There, the healthcare quadrilemma is a phenomena where state and the people think that the state is sponsoring of the health services through the insurance companies, which is being not utilized honestly. That is, the insurance companies, it is perceived that the insurance companies are using this money, this facility to earn the money. So there is another problem there in the Western developed countries. If you see the implant and equipment market share around the world, it is around $5 billion. And the cumulative growth rate annual is 16 to 19%. And you can see that the hand instrument market, which we had started in the late 80s, 90s, has nearly left out and fizzling out of the market, and the market is being taken over by the high-end equipments like endoscopes in last decade, more than a decade in fact. So concept of cost-saving innovation was highlighted by various researchers, not only by medical field workers, but also from the various NGO workers also. So Nelson et al. In 2009 looked into the articles which discussed about low-cost innovations. So they analyzed nearly more than 800 articles from 2002 to 2007. They found that none of them were cost-effective, talked about cost-effective innovation. So the cost-effective ratio was 2,128. Ideally, it should be negative. So it is positive 2128 instead of being negative to become cost-effective. So it was very opposite, showing opposite trend. So he's raised his concern why there is no regard, no concern for the cost of the innovations. So PLOS 1 in 2016 published a meta summary which compared robotic assisted laparoscopic surgery. Robot, you know that in last decade is being looked after by all the institutions, all the people, so-called fancy equipment. It was a meta-analysis was published comparing robotic assisted laparoscopic surgery with conventional laparoscopic surgery. And the conclusions was that conventional laparoscopic surgery is not inferior to robotic assisted surgeries when cost and outcome, patient outcome both were considered. So it is not necessary that the costly is the better. So if you see the last 4 to 5 decade groundbreaking innovations in the medical sector and social sector, you will find that many of the cheapest innovations like Jaipur foot hole in the wall, which was a computer facility for children, and mobile ultrasound, these were very cheap innovations which changed the medical facilities in the countries around the world. So why low cost innovations are not being done? This issue was looked by Harris et al. In 2017, and they found that it is the mindset that people are not looking for low cost innovations. Otherwise, they are capable of doing so. So it is important to change our intention. So in 2016, just giving an example, Marinus D. Kluwer, who is a renowned spinal surgeon, world-renowned spinal surgeon, he came to Delhi in 2016 at a spinal surgery workshop. He was using not even a single hand equipment. He was using hand instruments like hammer, chisel, curettes for addressing complex spinal diseases. And Takizawa in the same year came to AIIMS Delhi he is a renowned skull-based surgeon. So he was using stainless steel pins with a rubber band to retract skin and deeper tissues for complex brain surgeries. So for the same thing, we are using, or people are using $1,000 retractors. So you can see these renowned people are using almost no cost equipment, instruments for their surgeries, and they are excellent surgeons. So there is another thing, what we medical personnel are looking in the society. There is a social discomfort, unrest due to the cost of the treatment. The population who are paying out of pocket cost of the healthcare, the faith in the medical fraternity is gradually eroding, and this is resulting in violence whenever there is unexpected outcomes according to them, because most of the time, sometimes the outcome is not good due to the disease itself. And the society overall has doubts on the relationship between manufacturers, equipment, instrument dealers, hospitals, and doctors. So this is a bad situation. And it is not only in India, it is around the world in some form or the other. P.S. Ramani is a renowned spinal neurosurgeon at Bombay. So he's very respected, very ethical. So he raised this issue recently and raised the concerns that the people have doubts on spinal surgeon and implant industry's relationship. So these are issues that we have to look into, and all these problems are mainly due to the cost of the treatment that people have to pay from their pockets. So recently, AIIMS Delhi has come up with Agua pocket ventilator, which is very cheap, around 50,000, whereas it costs more than 2-4 lakhs of INR. So similarly, at Jabalpur, Dr. Yubayar Yadav, he's a neurosurgeon. He uses plastic tubes for brain retractions, for deep-seated brain tumors. So Otherwise, there are very high-end costly equipments are available for the same purpose, and the results are no inferior to the hand instruments or equipments. So I myself have used various equipments and published them also for spinal working endoscopic seed, cranial working endoscopic seed, and micro instruments. Otherwise, these equipments cost more than thousands of dollars. So we have to keep on looking to innovate, which are very cost effective and effective also for patient care. So it is important. We are very lucky, our generation of doctors, that we have worked where whenever there were no facilities available. It is important to train our residents, because maybe now they are being trained at AIMS or SGPGI or PI Chandigarh, like advanced institutions. Maybe in future they will work at a peripheral center where no facility is available. So it is important for us, we faculty, we teachers, we trainers, to train them also to work without advanced equipments. It is very important because it is not being taken care of at many centers. I have talked about in various institutions, in various lectures, and according to the perception is that the low cost innovations can only be done by people who are working in difficulty. It is not true. We have many students here who have come up with strange solutions of problems at AIMS Jodhpur. So once we place the students, our trainees, under some sort of difficulty, not allowing to use them equipment, under supervision, they may come up with strange things which may be very effective. And most of us doctors keep on doing many things which are very frugal, but maybe very efficient. We may think that these things are not important, but maybe these will be very effective or useful for others. So it is important to incite your colleagues, others, so that they can also indulge in such activities. So overall, the doctors,
we have a little bit on the timing side. Thank you so much for sharing the inspirational examples. So I will give you some few more minutes to wrap up the background. If that's okay with you?
Yeah. I'm about to finish. Actually.
Perfect.
So it is important that we have to train our students accordingly. So doctors and various organizations have to come together to cut down the cost. And it is important that this, I don't think that any time it would have been better to come up with such a nice idea of India-Sweden Innovation Center, and hope we will come up with nice ideas, nice innovations, which will be path-breaking. Thank you. Thank you very much.
Super. Thank you so much, Deepak, for sharing the, as I said, very interesting and inspiring examples, and also the concept of cost-saving innovation, which is very much needed both in India and on a global level. And of course, there I would also like to invite from AstraZeneca, Visyashri Mapari, Market Access Lead for AstraZeneca, to discuss a little bit about the details of the problem statement. Please welcome.
Hi, thank you, Sophia, and thanks a lot, Dr. Deepak. I think very beautifully articulated, with evidence, putting forth the need for innovation, how innovation can be an enabler in terms of bridging the important gap of access. But at the same time, how conscious we need to be in terms of ensuring that, the innovation is frugal, it is relevant to the market, and, is coming at a cost that is affordable. And therefore then accessible for all. So thanks a lot for setting and bringing in that context and perspective. And with that sort of a solid background, I think it's very easy for me to basically briefly talk about the problem statement. So from a focus area standpoint, the innovation challenge is largely focusing on the non-communicable disease segment, which is diabetes, cardiovascular, renal, metabolic, and oncology. And when we talk about oncology, it's typically the cancers afflicting women, particularly, and also looking at some of the common cancers such as bladder cancer, prostate cancer, oral cancers, which are predominant in India. And the idea behind focusing on non-communicable diseases is one, these are chronic in nature. and therefore there is a significant amount of demand that these disease conditions lay on the overall healthcare delivery system. Fairly resource intense kind of support that is required by these patients, right? And therefore then, we are focusing on NCDs as, a disease segment as far as this particular challenge is concerned. Then moving on to in terms of, across the disease life cycle, we aim to target all of it, right, from awareness up to, post-treatment hand-holding of patients, right? So any innovation which can be AI-backed, data, mHealth backed or telehealth and the others, right? Any kind of solution that enables us to basically achieve efficiencies across the entire disease life cycle of a patient would be of interest to us. So if I were to give some examples at a diagnosis level, right, we look at innovation as an enabler for us to, differentiate between, for example, different kinds of tumors or lesions, particularly, for example, let's say in the space of lung cancer, particularly, or even for that matter, when we are looking at lesions as far as female cancers are concerned, or when we are looking at chronic conditions like chronic kidney disease or heart failure, right? There is a lot of effort that is ongoing, and there is a lot that innovation can bring in terms of early diagnosis of these kind of conditions, because as you would understand, anything that get diagnosed early basically would result in timely intervention and would be, helping in achieving optimal outcomes as far as the patient is concerned, and overall bring in efficiencies in, the overall healthcare delivery system per se. So those are kind of solutions that we would be looking at. Similarly, we are also looking at solutions or devices that enable us, especially the physicians, to basically examine patients remotely, and which is, predominantly seen, especially in the present times, where because of the entire COVID scenario, physicians are not able to maybe interact with patients, examine patients, face to face. There is a strong limitation that's, affecting us today. But we do not want healthcare delivery to be compromised because of this constraint. And I'm sure that, telehealth solutions, mHealth solutions can play an important role here to basically bridge that sort of a gap that we have and enable physicians to basically, as I said, continue to examine their patients, also monitor the patients. So for example, a lot of times patients on chemotherapy or post-intervention, like, undergoing an interventional procedure, there is a hand-holding required in a post-intervention scenario. And especially in present times, it becomes much more challenging, especially if patients are coming from remote areas, right, to monitor these patients, to handhold those patients. And we are looking at solutions and devices that will enable the physicians to basically seamlessly allow them to basically interact with patients, to handhold patients, to monitor patients, with the help of devices. While we are doing this, we also want to make sure that we are cognizant of, the entire upskilling element of it. And so we would be welcoming solutions that are in the space of, technology enabled innovation that allows us to basically educate, impart skills, not just to the patients, but also to the physicians, to the caregivers, and the entire, healthcare worker community, so to say, because I'm sure that, again, the entire digital space plays an important role here to allow us to achieve efficiencies of scale and have a far wider outreach than you would be able to achieve maybe with face-to-face interactions. So any solutions in the realm of using digitally enabled platforms that allow us to have that kind of a wider outreach for skilling would be also another area that we would be looking at. Similarly, last but not the least, I think data is king, right? So today, in today's times, data and outcomes becomes that much more important. So any solutions that allow us to basically mine data, look at patterns emerging out of data that could then lead into better decision making, or any kind of predictive algorithms that we can build basis, data would be something that we would look at. Last but not the least, I would want to say that, to kind of reiterate what Sir said, right, while we look at innovation as an enabler, we have to keep in mind that it has to be reliable, it has to be scalable, it has to be relevant to the market condition, and it has to be therefore then frugal for it to be affordable and accessible to the larger gain of the population. So that's more or less from my side in terms of the innovation challenge per se and some of the details around it. But if you are interested, I would urge you to visit our website, which is indiaswedenic.com, where you will have all the more details around each of the problem statements that we've kind of stated out there. So over to you, Sophia. That's all from my side. Thank you.
Super. Thank you so much, Ashi, for introducing the problem statement. And of course, super interesting to hear about the push for digital healthcare to reach more patients, as well as what you just mentioned, looking at reliability, scalable, affordable, and accessible solution. That's something that we really need today. I know that there are many people within the SI network, as I said earlier, looking into the healthcare and also are very much involved in innovation. So I see that there are a lot of questions already popping in. And with that, I would like to give the word to my colleague Harika, and she would like to say some few things and then also moderate the question session.
Thank you so much, Sophia, and thanks, Jayashree, for highlighting the problem statement so beautifully. For all the audience here, we have launched the Innovation Challenge. And the Innovation Challenge is focused towards the startups and the innovators who has some brilliant ideas with respect to the problem statements that were shared by Jayashree earlier. And we would urge all of you to have a look at these problem statements, and we have all the details of these problem statements on the website. And Jayashree has very well summarized it as well just before this. We would request you to go to the website and have a look at the problem statements. And if you have any idea addressing those problem statements, we would request you to apply for that Innovation Challenge. We have, so obviously you will apply to the Innovation Challenge, but the Innovation Center ecosystem offers a host of benefits for the people who have onboarded into the Innovation Center platform. And some of the key benefits are something that are listed over here. And one such key benefit is the mentorship. Mentorship from not only the, as you would have seen from our earlier slides, that the collaborators that we have, such a strong network of collaborators right from AIIMS Delhi, Jodhpur, and AstraZeneca and ICMR and other knowledge partners as well. So we will get a range of mentorship from on wide variety of topics based on the query that you might be having. So the mentors that we have across the industry will be able to help in addressing that particular query. The other thing that we also offer is, though this platform doesn't directly provide funding to the ideas and startups that are there in the network, we will connect you to a wide array of investors that are there, both in India as well as in Sweden. And the idea is you pitch the solutions to the investors, and we act as a gateway for you to connect to those investors. The other advantage is with the kind of ecosystem that was developed, you will be able to showcase your solutions to much wider audience, and that will help you not only in increasing the reach of your solution as well as help you in scaling up also much faster. Global reach, again, not only to Sweden and India, with the support of AstraZeneca and Business Sweden, if you wanted to expand into other countries as well, or if you have any queries that potentially other countries could address, this could be a platform where you could address your global reach queries as well. And one more crucial thing across all the array of services is the incubation center. We have an incubation. When you're saying incubation, it's not only the physical space that we are offering. It is a range of services like laboratory access, deep tech laboratories that we have, live patient environment that we could facilitate with AIIMS, with our partners AIIMS, Jodhpur and Delhi. So we have an incubation center live at AIIMS Jodhpur campus as well as in NASCOM Bangalore. And if you want to utilize an incubation space, you're more than happy to use those spaces. And last but not least, networking, not only with the startup network, but also with the industry leaders and the healthcare experts. So that's the brief about the. Yes,
yeah, so we kind of invite you to apply, and for the applications that are successful, we're going to kind of choose the top few ideas and the entrepreneurs, and they will then be able to kind of utilize these services that Harika just walked you through. And this is one of the ways in which we are trying to connect to entrepreneurs and startups who can solve these problem statements to kind of reach some of the objectives we have, apart from other activities that we will do as part of this ecosystem. And then we can go to the timelines. Yes, Harika.
Yes. So obviously the last day to apply for this particular innovation challenge is 27th September. You could get all the details about the innovation challenge on your website, on our website, which will share it to you shortly. All the applicants will go through an evaluation process, and we will announce the winners on 25th of October. If you have any queries, please do post all your queries in the comments box right now. We will address your questions right next to this. Yeah. That's it from our side in terms of presentation. I request everyone to post your questions. Now we will address some of the questions that we have already received till now. Okay, the first question is from Rahman. I understand that interest of time. I would like to have your take on innovation in primary care service provisioning. Almost 70% out of pocket expenditure and 80% health problems are attributed to primary health. So Amrit, do you want to take this? The question is basically how I think what's your take on innovation in primary care service provisioning, considering the out-of-pocket expenditure in India is pretty high. And I'll also ask Dr. Deepak to address it after this.
Yeah. So I think maybe I will actually point to Jayashree. Since both of us have been working a bit on some of these, some of the primary healthcare center projects also in Maharashtra, etc. Maybe Jayashree, maybe I asked you to come in.
Yeah, sorry, I just have some background noise ongoing. Apologies for that. So thanks, Amrit. Basically, when we talk about innovation and the use of innovation in the primary healthcare settings, I want to, just highlight here that the entire India-Sweden innovation effort, is not something which is started now. It dates back to 2018 when some of our initial efforts have really seen the light of the day, right? And under that, there is already significant amount of work that's happened in the area of primary healthcare. I do agree that primary healthcare settings are the settings where ideally you can catch some of the ailments and some of the disease conditions really fast and quick, and innovation does play a key role here. But I also want to assure that there has been effort that has already been made by this particular platform in that area, where we have effectively used non-invasive point of care solutions that are affordable, that are compact, and actually have allowed us to basically take care to the doorstep of the patients. And the center that Amrit is talking about, which is a one of its kind center of excellence in remote areas of Maharashtra, is where where some of these things are actually put into practice as well, and currently ongoing as we talk. So part of that has already been addressed by us, but that does not mean that this particular innovation challenge would not focus on it. As I said, we are looking at the entire care continuum of the patient or disease life cycle. So we would welcome and want to look at solutions if they are innovative enough, apart from and distinguish from what we are already doing. We would definitely consider those and welcome those. So that's my answer to the question.
And probably even before the primary healthcare center, the entire awareness piece and that entire piece and any innovation there also, I think we cannot stress more on the importance of such things.
Yeah.
Okay.
Yeah. Thank you. Thank you both, actually. Okay, the second question that we have, in fact, is upskilling and reskilling should also be given a higher priority at this stage to address these challenges. Jayashree or Deepak, do you want to address this question?
Maybe Deepak can come in.
Yeah, I think it's a very good question. While we are bringing on the innovation piece to get diagnosis early or treat the patient with the right treatment, but I think upscaling the capacity and capability of the ecosystem of healthcare is also very important. And I think one of the key points in this health innovation is also about what can we do in terms of building capacity and capability. And one of the examples we can put across in the problem statement is these all MRIs, or looking at the ECG and making a quick decision to get door to needle or door to balloon time faster. So one is the innovation piece. Secondly is to look at that innovation, read that innovation, and make quick decisions also is an important aspect. So surely I think we will be looking at that aspect as well.
Thanks, Deepak. Okay, the other question, Amrit, is specifically to you. I think Deepak and Jayashree can add in, is the holistic pillar somewhere misses the importance of healthcare domain knowledge, which includes medical, science, pharma, manufacturing. Can you throw some light on how explicit focus can be given on these areas? I think it's I think some clarification in the holistic pillar ecosystem might be needed, Amrit.
Okay, so at least the way we are looking at it is, we have kind of tried to identify these pillars, and of course, I'm sure we will also kind of figure out as we go that are we holistic enough. But for us, we've tried to expand the definition to these pillars of technology, innovation, skilling, the entire business model piece, the data piece, etc. So from that perspective, but we need to layer that also with the partners we have brought in. So you have, at one level, you have how we're looking at innovation, but in Sweden you have this concept of the quadruple helix, and that is also where we are trying to move in terms of who are the partners we have when we are working with innovation. So to ensure that we have partners working with policy, and that we have today with the ministries, etc., involved. We have in academia, and with and that would include the medical fraternity, because you cannot leave out the medical science. Whatever we do has to be fact-based, science-based, and that's how we kind of look at it. So that layer is of course very important. The third layer is the company angle, the technology angle, and that could be pharma manufacturing itself. It could be product manufacturing. It could be anything also from that angle. And then of course it's also the entire civil society and the patient, etc. also. So we are definitely trying to strive to build this entire thing on the quadruple helix, which is also the success model for the Swedish model of innovation. And I would say in many ways we are working towards it, and this is going to be a bit of work in progress as we go along to bring in the right partners to have all these collaborators in it. I hope that answers or kind of response to the comment over there. Yeah. Okay.
If there's any follow-up question, please post it in the comments box. We'll try to address that. Okay. The other question that we have, I'll ask this to Dr. Kuldeep, is, can someone define the word frugal from a medical perspective?
Yeah, actually, frugal means that it should be like you can make innovation changes to adapt to the community at large. So whatever is existing in the society, if you can make it more suitable for the person and which is locally available, which can be locally adaptable, that is a frugal from the medical point of view. So in India, we say that jugaad innovations. So jugaad is one frugal, that is you make something very simple, which is already existing in the society at a high cost, but you make it more affordable for the society, for the community.
Thanks, Dr. Kuldeep. One more question again back to you is, in our areas such as menstrual health and mental health, etc., under the ambit of challenge? I'll give it both to you, Dr. Kuldeep, and Deepak to answer this question.
Yeah, actually, in fact, the menstrual problems are very high in the community if you go to the villages, and there is just so much restriction in the society that the women don't come out with their problems. And simple measures like menstrual hygiene with a simple methods can bring about the changes, the awareness. And also it is equally important that equality should be considered. That is, it is not only that the female are responsible for that. We have to understand and we have to make the people aware that it is also the male gender also should understand the problems of the women. And regarding this, so this public health, this menstrual hygiene and the sexual health reproduction is also one of the area. With the help of innovation, we can tackle this. Although there is a awareness, there are many programs, but if we can develop some innovative idea to address this issue, it will be quite helpful for the society.
Deepak, anything to add?
No, I think Dr. Deepak has very well alluded on that. Thank you.
Perfect. Okay. Amrit, this question is to you. Would you like to bring in organizations like Karolinska Institute who are also very well versed in bio-entrepreneurship?
Yes, we have parallel dialogues with a few Swedish universities. So that's very much part of this thought process to have academic partners from Sweden also involved in this. For example, Umeå University is a key partner that we are discussing with, and we are welcoming dialogues with other universities also.
Thanks. One more question again back to you. Is India, Sweden collaborating for anything other than the health sector? Something like an educational sector?
Yeah, so I would say education per se would, or in some senses, health education gets covered under this ambit where we are. We have started this collaborative exercise, at least from the Business Sweden side, with healthcare, at least. We hope, depending on how we succeed and the learnings we have, we hope to take this to other sectors also, where there are common interests between the countries. But we're not there yet. It's still early days for us.
Thank you. Deepak, this question is to you. Does this challenge also apply to established companies and solutions which have successfully addressed these challenges in other markets like Africa and South America? Deepak, you're speaking on mute.
Sorry, can you repeat the question?
No problem. Can this innovation challenge be applicable to companies that were established in Africa and South America, but those are addressing these challenges?
So this can go not only pan-India, it can go across the world. So once we select the innovation, I think when we look at developing countries, most of our problems are quite same, especially when it comes to South Africa, when it comes to African continent, or even South America, if you look into, or even in Asia, some of the out-of-pocket markets. So we will all look into the innovation, what can be done, as very clearly told by Dr. Deepak, in terms of, how frugal is the innovation, how accessible it is, and affordable it is. And today, accessible and affordability is a question everywhere. So anything which we develop here can be passed on across to many of the countries. So we're more than happy to do that.
Thanks, Deepak. Someone from KTH Alumni has offered us support. Arun from KTH Alumni has offered us support to extend for us in connecting to KTH. So that's great. Thank you, Arun. How about software aspect of the innovation that is socio-economic? Deepak, again to you.
Not clear with the question actually. What do we mean by socio-economic aspect? Are we talking about the innovation and its accessibility, or which problem statement you're trying to address? Sorry.
Yeah, Rajgopal, if you could further clarify on the question. From basis my understanding, it is if there is any software solution that that is an innovative software solution that addresses the socio-economic problems that were mentioned, I believe, if I read the question between the lines.
Okay. No, we have to go back and relate back to our problem. For example, taking a software example in terms of if that can be very effective for telemedicine, keeping the EMR more accessible, and also governance in terms of not leaking out the patient privacy, that can become very, if it's easy accessible, easily implementable, for sure, it may have an impact. It all depends upon what problem statement you're talking about, and then how you're relating that software with that problem statement from an innovation perspective.
Thanks, Deepak. One question is from a student, Mr. Martin Verghese. The question is, how can he collaborate with the ecosystem, and what kind of support this particular innovation center offer in implementing the technology in Sweden? Amrit, do you want to take this?
Sure. So I think a way we are kind of in some ways qualifying or inviting startups to collaborate is through this innovation challenge. And typically, I think we're saying that at least for you to apply for this innovation challenge, while you can be a very early stage or idea stage, you should at least have some sort of prototyping done, because you should have reached some level of maturity behind the concept you would like to propose that can be the solution. Therefore, if there is something within this area of embedded and intelligent systems that links to one of the problem statements, and you have a concrete idea or a solution for it, then we invite you to apply. And if you do kind of succeed in the innovation challenge, then as part of that, the various aspects that we spoke about, the services in terms of mentorship, funding, etc., these will not be limited to just things happening on ground in India, but across the countries, and those could be availed by yourself there.
Thanks, Amrit. Mr. Kishan has a follow-up question on the edtech sector. Whom do I contact for all the questions, and if I'm looking for any collaboration in this domain in future? It will be Amrit, Mr. Kishan.
Yeah, you can contact us, or if you are already part of the SI Alumni network in India, then I would ask you to also maybe reach out to Sophia, who we are coordinating areas of collaboration within the alumni.
Yeah, okay, then could you please share the details of Sophia? I will get in touch with her.
Sure, we'll email it to you after this.
Okay, great. Thank you.
Thanks. One question, Amrit, again back to you, is which division of Ministry of Health you work directly with? Ministry of Health India.
Yeah, so this is with the Ministry of Health in terms of, so our collaboration is with the entire Ministry of Health, and it depends on the area of work that we are doing. They kind of rope in the related joint secretaries to get involved, but most international cooperation is led by the international cooperation section at both ministries.
Thank you. Thanks for the support that was offered, Dr. Srinivas. We will get in touch with you if we require any support in this collaboration. Thank you so much for the support extended. So those are the questions that we have till now. If you have any further questions specifically on the Innovation Challenge and Innovation Center, reach out to the contact details that were shared on the screen. If you have any questions on the alumni and other networks, I would request to reach out to Sophia and Amrit. Sophia, back to you.
Before Sophia jumps in, so it's good. Thank you for allowing us to kind of present both the Innovation Center and the Innovation Challenge, and maybe the Innovation Challenge is relevant to some of you who have participated today. But we also have one more ask of you, is that all of you are being associated with Sweden. In many ways, you are ambassadors of Sweden, who have been connected to the Swedish story and now are probably in different parts of the world, in India, etc. And we would request you, in benefit of a wider sector and your networks, please feel free to share information about this innovation challenge among your health networks that you all might be part with, if you feel they can take benefit of this. We will highly appreciate you to do this for us. Sophia, back to you.
Super, thank you so much for a very engaging session, and interesting to listen in to all the good or great questions, I would say. Very interactive now in the end as well. Firstly, of course, I would like to thank our speakers, starting with Rebecca, and then we have Amrit and Shubhang from our side, Dr. Deepak, and also Jashri, for sharing the information and the background behind both the center and the challenge. And of course, for Harika to moderate the question session. Of course, please reach out to the team, the innovation team, regarding if you want to join this, and we really encourage you to do so. And for the alumni activities and any questions regarding thematic areas or similar, you can reach out to me or Amrit. Looking at education, of course, we can look at other areas such as sustainability and similar. And I know that the network and the Alumni chapters, they do a lot of great activities within different verticals. With that said, I, of course, would like to thank you so much for joining for this session. And we are looking forward to connect with you on the various levels. And hopefully I will see many people applying for the Innovation Challenge.
Yes. I would request everyone to switch on their camera so that we can take a group photo, specifically the speakers.
That sounds amazing. Let's do that.
Look, I can't tell you. Deepak, I still can't see you. Dr. Kuldeep.
Yeah, sorry.
Okay, I'm taking it for now. Thank you so much.
Thank you.
Thank you. Thank you so much for joining, and wishing you a very great day. I don't know the timing where you are right now, so even if it's evening, morning, or lunchtime. Thank you.
Thank you. Thank you.
Thank you, everyone. Bye-bye.
Thank you very much.
Thank you.
Thanks.
Thank you.